So endophthalmitis, endo means inner, inside. Ophthalmitis is an inflammation. So the inner structures of the eyeball are getting inflamed. That is the ovial tissue and the retina. So ovial tissue means itself iris, ciliary body, choroid, all that is included. And also retina portion is involved. So what you can see here is the choroid retina is involved, but sclera is not involved. Sclera is paired. If the sclera has got involved, sclera and the surrounding tinous capsule, then we call it as panophthalmitis. Okay, so here there will be exudates in all the chambers: anterior chamber, posterior chamber, vitreous cavity. You can divide it into infectious and non-infectious. So non-infectious means there is no infection, it is sterile. Okay, then why it is caused, how it is caused if it is sterile? It is because of some toxins, some toxic substances, that some chemicals. So from where these chemicals have come? It can be the chemicals adherent to the lens, the IOL which is placed, or adherent to the instrument. Okay, then toxic anterior segment syndrome means after the lens is placed there will be a reaction. It's a hypersensitive reaction from our body, toxic anterior segment syndrome. So it can be like post-traumatic sterile endophthalmitis, some any retained foreign body against that reaction against that, or phacoanophylactic. So that is because of the lens protein in the Morgagnian cataract, the lens protein will be released. It's actually a capsular bag of milky fluid. Later it can get leaked, so that it will induce antigen antibody reaction. So that can be phacoanophylactic endophthalmitis or any intraocular tumor necrosis. Infective endophthalmitis is modes of infection. An infection which has come from outside can be a trauma, a perforating injury, or a corneal ulcer or an abrasion, and an organism has entered through that infection, infected corneal ulcer, or some intervention from outside, any operation, previous history of surgery. Endogenous endophthalmitis. So endogenous infection means already patient is having infection somewhere else in the body. Dental caries, septicemia. Secondary infection following infection from orbital cellulitis or infected corneal ulcers. That means after some infection in the nearby structures, infection spread to the eyeball from the orbit or from the corneal ulcer, like that. So the causative organisms, bacteria, fungus mainly. So the onset can be acute or delayed. So these are the organisms. You can just remember staph, strep, fungi. There will be Aspergillus, Candida, Fusarium. So risk factor you can just imagine. Immunocompromised state. A person who is having immunosuppressive, long steroid therapy, diabetes, or some autoimmune disorders like rheumatoid arthritis. Then local causes means infection in the nearby, blepharitis, using contact lens, conjunctivitis, dacryocystitis. Intraoperative means those there is a prolonged time of operation, or there was contaminated instruments usage, vitreous loss was there. So such people. So even patients on bacterial flora can cause this. Patient having, so patient who had a history of surgery recently, about 1 month, and patient is coming now with the symptoms like pain, redness, photophobia, lacrimation, diminution of vision, discharge. So all these features like conjunctivitis, uveitis, we have a lot of DD, but this patient have a history of recent surgery, then you imagine it can be endophthalmitis. And signs: lid is red, swollen, conjunctival chemosis, circumcorneal congestion, cornea edematous cloudy, anterior chamber hypopyon, iris is edematous muddy, all this. Pupil is showing yellow reflex. So normal pupil shows red reflex. Here it is yellow reflex because of this exudate, purulent exudates. And emerotic cat's eye reflex, it is the what you can see yellowish white mass is seen through the fixed dilated pupil. You can see yellow white mass. IOP raised in early stage, or it may decrease later. Then diagnosis, you take the history, you examine, you can do a USG, okay, and you can take the exudates can be aspirated, you can send for staining, microbiology, and you can identify the organism. So treatment, you are giving antibiotics, which is intravitreal. Okay, intravitreal antibiotics, topical concentrated antibiotics, systemic antibiotics. So usually these are given. Steroid therapy is given in case of sterile endophthalmitis, not in infective. If you are giving in infective, infection can again proliferate. So you give in sterile endophthalmitis, non-infective causes. Supportive therapy, you have giving atropine, cycloplegic, anti-glaucoma drugs in case IOP raised. Now if all this has not been beneficial, you take the vitreous out, vitrectomy. Next is panophthalmitis. Here we know the surrounding tinous capsule is also inflamed. Okay. Symptoms are almost same. Pain, headache, watering, discharge, redness, swelling, loss of vision. Signs are almost same. Lid having edema, hyperemia, proptost, ocular movements are limited, painful, chemosis, congestion, edema, pus. So this is what we have told right now. Eyeball, what happened? Proptost, ocular movements are limited. What happened to cornea is a cloudy, edematous. What happens to lids? There is hypopyon. What happened to the conjunctiva? There is chemosis, congestion, anterior chamber. There is full of pus. Vision is lost. IOP, it's markedly raised. Globe perforation may occur at the limbus. So complication is lead to infection, can go to brain. Meningitis, encephalitis, cavernous sinus thrombosis, orbital cellulitis. So treatment, anti-inflammatory drugs, analgesics, antibiotics, evisceration. Evisceration means you are removing the contents of the eyeball, leaving behind the sclera. It's like whenever we have some fruit, we take the contents inside the fruit and the shell will be left. So like that, the sclera is left behind. Frill evisceration is performed. So 3 millimeter frill of the sclera is left around the optic nerve. So more healing than an evisceration. Also prevents the spread of infection up to optic nerve, which might give rise to meningitis. So you will do this in expulsive choroidal hemorrhage, panophthalmitis, bleeding anterior, staphyloma. So what are the conditions where evisceration is done? One is when the entire eyeball is inflamed, panophthalmitis. Next is severe bleeding anterior staphyloma. Then expulsive choroidal. So bleeding, we know whenever we say bleeding from the uterus, we say last point will be hysterectomy, like that. Bleeding anterior staphyloma and expulsive choroidal hemorrhage. So there is a peritomy, that means conjunctiva. Then you remove the cornea, remove the ocular content, you scoop out the content. You can implant orbital implant, sclera and conjunctiva sutured over the implant. So that's about endophthalmitis. So endophthalmitis and panophthalmitis difference. Symptoms, signs, that's very common, seen in some other conditions like conjunctivitis or uveitis, almost similar to that. Then what are the classification you can have? Infectious, non-infectious. Infectious can be exogenous, endogenous infection. What are the conditions where evisceration is done?